Good day, and welcome to the webinar for the Macy Foundation's Catalyst Awards for Transformation in Graduate Medical Education. I am Peter Goodwin, Chief Operating Officer and Treasurer at the Josiah Macy Jr. Foundation. The purpose of today's webinar is to provide you an opportunity to hear more about this special request for applications for the Catalyst Awards. Today, we will share with you the background, the purpose, the application process, and the selection criteria for this awards program. Our agenda today has two parts. We will start with a presentation, which will then be followed by question and answer period. At the end of the Q&A period, we will spend our last few minutes on some details you will need to know in order to submit an application to the program. This webinar today is being recorded. You will be able to view the slides and listen to the presentation and the Q&A portion of the webinar on our website within the next week. For any questions you have during today's presentation, please use the Q&A function on your screen. We will answer as many questions as we can at the end of the prepared remarks. And now, I am pleased to introduce our presenter, President of the Josiah Macy Jr. Foundation, Dr. Holly Humphrey. Holly?
Thank you, Peter, and hello, everyone. I'm very pleased to be with you today to have a chance to talk about the Catalyst Awards for Transformation in Graduate Medical Education. So let me say just a word about why the Macy Foundation decided to create this special initiative. I think you are all well aware of the COVID-19 pandemic that continues to have a huge impact on our society and in particular on our graduate medical education programs. It has clearly been a pandemic that has brought out some of the incredible strengths of our graduate medical education programs and the people in those programs in particular. The accomplishments of those on the front lines, the residents, the fellows, other members of the health professions team, the staff working in our hospitals, our clinics, offices, in the community setting. Everyone has played a Herculean role in managing the pandemic to date and continue to do so. This particular award is designed to focus specifically on one group, specifically the group of residents and fellows in their residency or fellowship programs who are on the front lines day after day, month after month, and now it's fair to say year after year, working in these pandemic conditions. And so while there are several things that we've learned about our graduate medical education system that I think will enable us to improve and move forward in a way that's very positive, I think the pandemic also has brought out some true chasms where we previously had fault lines in our healthcare system and in our educational programs. And it's for that reason that the Macy Foundation decided to create these Catalyst Awards. We are hoping that by creating these Catalyst Awards, we really will have an opportunity to transform graduate medical education. It's extremely difficult to do that in a setting where our society finds itself more polarized than it has perhaps ever been, but certainly more polarized than it's been for many decades. And so we would like, with these awards, to, at a first start, to have our trainees, the residents, fellows, the faculty, and other members of the health professions workforce work together to have the skills and tools to develop relationships with their patients that are in fact therapeutic, even when the political views or social views may be very much at odds with a therapeutic relationship with our patients. And so we hope that the interprofessional teams that are on the front lines will have a chance to move forward in a supportive and positive way, at least through the institutions that will have these awards. Now, throughout the pandemic, not only did we see inequities for our patients related to poor access to care, to inequities in illness and death, inequities in loss of employment, in food and housing insecurity, but we also saw that these same social factors impacted those who are our residents and fellows. They themselves, without a safety net, struggled to just get by and at the same time to learn all that they were expected to learn in their respective residency or fellowship program. So for the healthcare workforce to be truly supported, we are aiming to try to offer some support through these Catalyst awards. Now, there are many positive aspects of our clinical learning environments. We are hoping that we might be able to not only identify those Catalyst awards, but that we will be able to identify some of the ways in which a positive clinical learning environment might be able to be disseminated among multiple programs across the country. It's also the case that during the peak of the pandemic, we saw presenteeism come to an end, where residents and fellows who historically came to work while sick, suddenly it was very clear you could not come to work while sick because of the possibility of transmitting a respiratory virus to coworkers and, importantly, to patients. However, we are already seeing that some of that presenteeism is creeping back into our system because often residents feel this unbelievable dedication to their peers, to the program, to their patients. There may not be adequate backup coverage systems for those patients. There's often a fear of letting down their teammates, and a very long-standing culture in our graduate medical education programs, which has valorized neglecting personal care almost as a professional ideal. And so I am hoping that we can really turn the tide on that very long-standing culture and instead promote a culture of health and wellness for everyone who's delivering care in the healthcare setting, and importantly for the patients and their families who seek care in that setting. So on the next slide, you actually see the purpose of the Catalyst Awards. And the purpose is, first of all, to fund projects in GME that will catalyze transformation, as I've already mentioned, in the clinical learning environment. We aim to help support you as programs to implement innovative strategies to equip our GME learners with the tools, skills, and strategies so that they can flourish in this environment. We will be making 6 awards, each of which will be $50,000 for the period of 1 year. Now, who's eligible to apply? We have a very broad net for who can apply, and we are hoping to see applications from residents and fellows themselves, from our faculty, and from our staff. And importantly, when you have a chance to consider the application itself, it would not be surprising to see applications from that entire group of people. So let me just say a word about the components of the application. We will expect that you will be able to outline the purpose of the plan that you have in mind, the methods that you're going to use to both implement and evaluate your potential success with this plan. We're looking for what outcomes you are hoping to achieve with your innovation. We want you to discuss the barriers that you anticipate and the limitations that you can anticipate in advance. And then very importantly, we'd like to hear your plans for communication and dissemination of your award, because as I already mentioned, we are hoping that whatever projects you implement in your program might well be projects that can be adapted and adopted by programs across the country. And then finally, we're looking for your plan for sustaining this initiative once the funding from the Macy Foundation goes away. Now, in addition to the project description, which should not total more than 5 pages, we will look for a letter of support from the program director or the department chair where this innovation will be taking place. We are asking for a biosketch for the principal investigator or investigators for this award. And of course, a detailed budget for the plan that you have in place. Now, it's also the case that you may be interested to know upfront what our selection criteria are. So we are going to be looking for the importance of the innovation that you have for the clinical learning environment and the originality of your idea. We're also, as I already mentioned, looking for the sustainability of this idea. We're looking for evidence of the departmental commitment to the program, which is why we're asking for a letter of support from the department. So it is not enough to say that the department supports the principal investigator or that the program director supports the principal investigator. We're looking for the program or department to say that you're supporting this idea and you are willing to not only support the idea in spirit, but perhaps you have some innovative ways to support that idea with tangible evidence of support for the innovation. And then, as I already signaled, we will be looking for evidence of co-creation, and this may be a really good opportunity to zero in on residents or fellows together with their program directors, perhaps with other healthcare professionals, the nurses, the chaplains or social workers or whoever might be relevant to your project. The more that we see evidence of co-creation, the more that our review committee will be favorably disposed toward your application. And then finally, we're looking for the 6 grantees to come together at a meeting that will be convened by the Macy Foundation in 2024. So after the program has been implemented, to share lessons learned and how we might learn together to move forward to transform our clinical learning environments. I also want to say a word about the process that we will use to make these selections. All applications will initially be reviewed by Macy Foundation staff. We will be looking specifically to make sure that the application is complete and has all of the elements that I already spoke about. And then we will be using a group of external reviewers who have deep expertise and experience in different specialties and disciplines within graduate medical education. And so here are some of the key dates that I want to bring to your attention. The first of which is that our application portal for these awards will open tomorrow and it will close on September 15th. This application timing was designed with you in mind. because we know that the summer months bring the challenge of onboarding a whole group of new residents, and then later in the summer, new fellows into your programs. And then the whole cycle starts all over again with you reviewing the applications for the next group of trainees who you will actively invite and recruit to your programs. And so we're trying to time this application cycle in a window of opportunity for you to be able to more easily apply in the midst of your very, very busy schedules. The final selection for these awards will be made and announced in December, and then project funding will commence at the beginning of 2023. And will end 1 year later in 2024. And as I already mentioned, the Macy Foundation will sponsor a convening of the Catalyst awardees so that we can do, as I said, learn together and try to disseminate those lessons more broadly across the country. So with those comments, I will stop and invite your questions. Again, as Peter Goodwin already mentioned, please use the Q&A function on your Zoom screen to ask questions, and I am ready to hear what's on your mind.
The Q&A function on your Zoom screen is available for you to type in a question. We will triage those questions as they come in, and we will try to get to as many of them as is possible. Holly, first question is about whether or not we will allow in this program for co-principal investigators.
Absolutely. We do allow for co-principal investigators. We do not set a specific number of investigators, so that will be left up to you and how you manage that within your own program and your own department. So yes, co-investigators are welcome.
Holly, thank you. This next question gets to the clinical learning environment, which transforming it, admittedly, is a very broad topic and quite an immense task. Are there any specific areas of focus that you are interested in as folks consider their application to the program?
Yes, that is a great question. And I invite all potential applicants to think very broadly, just as you are already doing, about the clinical learning environment. However, I do want to mention that the Macy Foundation has as a strategy right now 3 funding priorities within the clinical learning environment. And it is very likely that if we see programs or projects that at least touch on one of these 3 areas, it is likely to be more favorably reviewed. So let me just briefly outline what those 3 funding priority areas are. The first is creating clinical learning environments that really welcome and celebrate diversity, equity, and belonging in those environments, so that everyone who works in those environments or receives care in those environments feel as if they belong. And so the opportunity to meet that funding priority is immense. And that may invite you to think about using holistic review in your residency or fellow application process. It may invite you to think about, are there strategies for helping the residents or fellows or members of your interprofessional teams manage abusive or racist patients? What is the language? What is what are the tools that we can use to keep the patient safe, but at the same time draw boundaries around what is or is not acceptable? Those are just a few examples of how the diversity, equity, and belonging priority area has a direct relationship to the clinical learning environment. The second priority is support for collaborative, high-performing teams. And this priority area really builds on the decade of investment that the Macy Foundation has made in interprofessional education. And there are a number of groups around the country who are really trying to support and elevate the importance of collaborative, high-performing interprofessional teams in the clinical learning environment. And boy, has that been a challenge during the pandemic for a whole host of complicated reasons. And I know that many of you know this from firsthand experience. And so are there ways that we can better support the real collaborative efforts of our interprofessional teams? Because to the extent that we can do that, we really do have the possibility of transforming our clinical learning environment. And then thirdly, our third priority area is navigating the ethical dilemmas that arise in the clinical learning environment. And once again, the pandemic, I think, has given us a myriad of examples and opportunities to consider the ethical dilemmas that come up every single day, whether that's with our patients or with our administrative structures or the overall healthcare systems that create the moral distress and the moral residue and ultimately the burnout or the depression that can take place. So there are, I think, a whole host of opportunities within that priority area as well. Now, having highlighted what the three priority areas are for the Macy Foundation, I do want to say that you may have a project in mind that is unique to your setting that does not necessarily fit in one of those priority areas, and I welcome you to submit that as well. I personally spent 14 years as a program director, and it was in those 14 years as a program director that I saw firsthand the many, many opportunities that the residents pointed out to me on a regular basis for things that we could fix, often that didn't require a whole host of resources, but they required the kind of focus and attention that getting everybody within the healthcare system or hospital on board could make a big difference for. So while you're not limited to our three funding priority areas, certainly, as I already mentioned, I think you will potentially have some extra points if you are able to adapt your project to one of those areas.
Thank you, Holly. This next question gets at eligibility. And the question is the program open to all residencies?
Yes. This program is open to all residency programs and all fellowship programs where there are residents or fellows training within that program. If you have a specific kind of program in mind, I'd be happy to answer that. But yes, this is open to all programs without limitation.
Thank you. This next question gets at the project itself and whether or not it is something that has already been started. And it's specifically the question is, can the funds under this award be used to help support a project that has already been piloted, but not sustained?
Yes, I think that is a wonderful example because I know that many of you on the front lines are piloting projects on an ongoing basis, and you do have difficulty sustaining them. If you end up submitting a proposal with that kind of a project, I would just caution you that we are going to be looking for sustainability. And so while you could think of this as a one-year effort to sustain your program, we are going to be judging your proposal on what's going to happen after that 1 year. So yes, if you have a pilot project with some pilot data, we welcome that kind of an application, but we will be looking for long-term sustainability. We're also looking, as I've mentioned, for the possibility that what you have piloted and now potentially funded through a Catalyst Award, what's the potential that that could be picked up and implemented by other programs?
Thank you. This next question asks, are you open, or is the foundation open to cross-program collaborations as opposed to one specific specialty or site?
Yes, absolutely. And while I did not mention that as a specific criterion, I think that's a really good example of the kind of proposal that can get some extra points, because at the end of the day, the Macy Foundation is really aiming to help transform graduate medical education. And, you know, it will take a lot longer if we do that one program at a time. It will happen much more quickly if there are programs and projects that can be easily disseminated both within your institution or across institutions. So we very much would be attracted to proposals that bring people together from different specialties and or from different institutions that can take a great idea and begin to transform GME across your institution or across the country.
Thank you. This next question has two parts to it. The first is if you could clarify whether any institution with a GME program is eligible. And second, will you accept multiple applications from a single institution?
Yes, great questions. So the answer to both questions is yes. So if you are a GME institution with a residency and or fellowship programs, yes, you are eligible to apply. And the second question, will we accept multiple applications from a single institution? The answer is yes. And the reason for that, quite honestly, is that many institutions have many residency programs in a variety of different kinds of fields, ranging from primary care fields to surgical subspecialty fields and general surgery fields for hospital-based specialties. So we are aiming to support GME in the broadest possible sense, and that is exactly why we are accepting multiple applications from a single institution.
And Holly, here's another question along this similar theme is the foundation open to funding a multi-program, multi-specialty proposal that would be organized by an association or other nonprofit organization as opposed to just one GME program?
Yes, I don't know exactly what you have in mind, but the elements of the question that are intriguing are the fact that it's multiple programs and a specialty association has a very broad reach. So that is the kind of example where a great idea could be disseminated nationally very quickly with the support of a specialty organization. So yes, we would accept that kind of proposal.
Thank you. This next question has to do with the letter of support that you referenced during the discussion about the application.
Yes.
Could you please describe what is expected as far as a department or program support? What are you looking for in the letter itself?
Yes. So we don't have hard and fast criteria for that letter, but what I am trying to signal in my earlier comments and now again in follow-up, that it's not uncommon for foundations to receive letters of support that speak to the strength of the PI and the incredible accomplishments that the PI has made at the institution. And of course, we love to read those kinds of letters. But what we're really looking for beyond the strength of the PI and the support for the PI is this department willing to make this project successful? And in your local setting, that might mean you need your department to settle some political battles with some administrators, or it may mean that you need some matching financial support from your department. We're not requiring matching financial support, but I can tell you if we were to see that kind of support, you would get some extra points there because we would know that your department or your institution is kind of putting their money where their mouth is. Just as the Macy Foundation is putting our money on the line, we welcome the opportunity for institutions or departments to join us in trying to transform the clinical learning environment. So again, those are not hard and fast expectations, but I'm trying to send a signal that we need evidence of support from the department or the institution that go beyond their admiration for you as a principal investigator.
And this follow-on question from another attendee also asks, when you talk about tangible evidence of support, is that what you were getting at, or is there more that you're looking for?
No, the comments that I just made related to tangible support, whether it's negotiating political battles or issues with your local environment, whether it's in your health system or in your local state system, that there is support to help you do that. Or, as I already mentioned, related to the budget, maybe there's some matching financial support that the department is willing to put forward as well.
Thank you. Our next question has to do with a project itself. The attendee asks is whether or not we would consider a proposal to evaluate and disseminate an existing program that has successfully run for many years for all of its GME trainees. In here, what they are asking is, while the program aligns very well, they would like to do a more rigorous evaluation and then come up with a plan for dissemination for this successful project for GME trainees. Would this fit under the initiative?
Yes, I think that could fit. It's not uncommon for good ideas to be implemented and not evaluated. And not disseminated. And those are the reasons why I'm saying that that could fit. All those other criteria, however, will still apply and be relevant. So what evidence will the reviewers see for sustainability of your idea? What evidence will the reviewers see that this really could be effectively evaluated and disseminated? So those criteria will still be in place, but the general idea is one that would certainly qualify for submission.
Thank you. One of our attendees would like to know is if they have received a Macy Award in the past, can they still apply for an award under the Catalyst program?
Absolutely, yes. So there is nothing that would disqualify you from applying. In fact, those who end up receiving funding from the Macy Foundation in any number of different ways often apply more than once. And sometimes groups have actually been funded more than once. So yes, you are welcome to apply and you are not disqualified by having previously received Macy Foundation funding.
This next question is about the convening in 2024 that you mentioned for the 6 programs that are successful in receiving funding. And specifically, the attendee is asking whether or not the trip to this convening is part of the Catalyst Awards budget or not.
That's a great question. And Peter, I'm going to turn to you to help me answer that. I think because it's in 2024, we can plan for that in our budget. But perhaps you have a point of view that could expand and elaborate on that.
Yeah, I think I would answer that by saying that we do not expect you to cover that trip through the $50,000 award, but that we are setting aside funds in the Macy Foundation budget for you to travel to that location, which has yet to be determined, where we will host a meeting of the 6 programs. Holly, this next question asks, can residents serve as principal investigators for an application to the Catalyst Awards program?
Yes, absolutely. In fact, we really encourage that. Now, we encourage the submission of proposals from residents or fellows, but we are strongly encouraging co-creation where the resident and or fellow might create a submission together with their faculty. And of course, the resident who may be the PI will need a letter of support from the program director or department chair. So to summarize, yes, residents or fellows can serve as the PI. Second, the more that our committee sees evidence of co-creation, meaning between the resident and the faculty, those are kind of bonus points. And then thirdly, every application will need a letter of support from the program director or department chair. I know that many program directors may be applying for these awards, and in those cases, we specifically would like to see a letter of support from the department chair for a proposal on which the PI is the program director, or there are co-PIs that are the program director and a resident or more.
Thank you. This next question, the attendee asks, is it correct in stating that the purpose of this grant program is to transform both the clinical learning environment and the clinical care environment in a coordinated way?
I love that, that articulation, and the answer is yes. Now, that is a big job, and everybody participating in this call knows how big a job that is. However, in even some small way, in some domain in which that clinical care is being provided and trainees are learning the skills and tools to work within that environment, there really are opportunities for transformation. But I think that the clinical learning environment goes hand in hand with the clinical care environment, and what's good for one is good for both. So yes, that's exactly what we're hoping to do.
Thank you, Holly. This next question builds on a previous one, and it asks if the applicant is going to be a PI as a fellow and a chief resident level, is it okay to pass that off among chief residents with the same faculty co-developer?
Absolutely, yes. I love that idea. And I know the importance of supporting chief residents as individuals and as a collective whole of very, very important leaders for the program. So yes, if there's the same faculty member as a co-PI with one or more chief residents that may transfer from one year to the next, that would be absolutely acceptable. And in fact, very much welcomed.
Thank you, Holly. Earlier in your presentation, you talked about the 5 selection criteria: importance and originality, sustainability, evidence of departmental commitment, evidence of co-creation, and commitment to send a representative to a convening. Are you able to give any insight as to sort of the relative importance of those criteria, or are they all equally important?
Well, I think at this point in the process, which is, the very beginning before our application portal has even opened, I would say they are relatively equal. However, I will also say that at the end of the day, this really comes down to a good idea that has the potential for implementation and dissemination. And that will ultimately, I think, be the focus of our review committees, both the internal committee as well as the external committee. So while it's easy to say on the surface that those criteria are all relatively equal, at the end of the day, it will really be the quality of the idea and the ability of that idea to really be implemented and disseminated.
Thank you. We have completed all the questions that have been asked of you, Holly. I'm going to leave the Q&A open for others who may ponder other questions that they'd like to submit before we then move to close the webinar if there are no further questions. So we'll leave it open for a few moments. And in doing so, we have another question. Holly, will this program, the Catalyst Awards program, be offered next year, or is this a one and done?
Great question. At this point, we are thinking of this as a one-year program. However, we are learning side by side with you. There are a whole variety of different ways that the Macy Foundation aims to transform the clinical learning environments. One is through our grants program. One is through our Macy Faculty Scholars Program. One is through the opportunity to convene important meetings. And so we are testing this idea, and we're going to learn from your submissions and from this award process. And depending upon what we see and what we learn, we may well come back with more in the future, but I certainly am not going to commit to that right now until we see what we learn from this first round.
Thank you. Here's, Holly, a question about a potential project. If the proposed project focuses more on the learning environment and they intend to track the clinical learning, the clinical care environment as an anticipated secondary effect, would that still count and be an eligible proposal?
Oh, absolutely. That would not only count. I think that's exactly what a transformed clinical learning environment should ideally do, and that is to positively impact clinical care outcomes. And so if you have an idea for doing that, it would absolutely be welcome, and I would look forward to reading that proposal.
This next question is about indirect costs. Will they be deducted from the budget, or are they in addition to the $50,000 award budget?
Peter, I think that's a good question for you.
Yes, thank you. So the indirect costs are part of the $50,000. So it is inclusive of direct costs and indirect costs of no more than 10%, which total $50,000 for the entire award. So it is inclusive of indirect costs.
And let me just underline the statement that Peter made about no more than 10%. The institution where I spent my career had an indirect cost much higher than 10%. And my guess is most of you, or many of you, have that as well. So you should just be cautioned right up front that we at the Macy Foundation are setting aside no more than 10% of your budget for indirect costs. Sometimes individuals in the grants offices tend to want to make that percentage significantly higher. So just a word of caution on that point.
We have no new questions coming in, but we'll leave the Q&A open for another moment or so before we move on to the wrap-up portion of this webinar. Holly, do you have any concluding remarks before I move to make the wrap-up comments in this webinar?
Yeah, thank you, Peter. I would just like to say to all of you in the GME community how much we appreciate the work that you're doing, how difficult that work has been, especially over the last several years. And this is one small way for, I hope, all of you to feel a signal of support, of admiration, and of deep gratitude for the work that you and your residents or fellows do every single day. So thank you for all of that. I look forward to reading your great ideas and to being in touch with those who will be the recipients of the Catalyst Awards. Thank you.
Thank you, Holly. Before we end, just a couple of concluding remarks that are more housekeeping related. And that's about our online application. We are utilizing an online application for this program. To access the online application, you will have to go to the Foundation's website, www.macyfoundation.org, where you can click on the Grants button in the navigation bar at the top of the page. There will be a drop-down menu where you will see a Catalyst Awards button. For your convenience, the URL is displayed on this slide as well. Once you're on this page, you can click the Start Your Application button to be directed to the online application platform. On this page, you can also preview the application by clicking on the Preview Application button so that you'll understand in full what will be required of you in the application format and structure. Now, in order to apply to this program, you will need to register for an account on the online application platform. And you'll also need to get the tax ID for the school as part of the registration process. Once you've registered and logged in, you can save and return to your application as often as you like prior to submitting it. And if you have any questions during the application process over the next 2 months, you may email us at info@macyfoundation.org. But before you email us, we encourage you to review the website at the URL on the slide, and we'll continue to update the webpage throughout the open application period. And finally, as a reminder, next week, a recording of this session, including the audio portion and the slides, will be available on our website for you to review. Thank you for your attendance today and for your participation in today's webinar. Best wishes to all of you, and have a good day.